So a patient goes to you and they're one of the two categories. Really bad teeth and gums. The teeth have to be removed, but they don't want dentures. And then the denture wear. If they go to your office, what are their options when it comes to dental implants?
That's a very good question, Randy. Basically, there is only 3 options, okay, for a lower jaw denture wear. The first option is to basically place 2 dental implants into the chin and provide them with a snap in and snap out.
Okay.
The advantage of this is that it's still a denture that holds better compared to the adhesive, but it's still removable. It's still an appliance that needs to be maintained. You still have to go to the dentist. They still have to realign it. Those housings, those buttons break once in a while and you have to change them. So even though it's a little bit more comfortable than a classic and standard denture, but we still have the negative aspect of having a big bulky piece of plastic that needs to be maintained.
You're not a fan of those?
We're not a fan of that. These are, again, entry-level type of procedures that are offered by probably less experienced doctors and surgeons, the newer people.
Okay.
But that's not an end product that is satisfying a patient for the long term.
Okay.
The second alternative that we have is to, on the lower jaw again, place a couple of more implants, so probably a total of 4, and provide them with a bar retain and a denture that still clips on it. It's definitely more convenient and easier than the snap in and snap out, but again, it's still a denture. The clips have to be changed. They do break. You still have, again, a big piece of plastic that comes in and comes out that you have to remove at night before going to bed and brush it and put it in a cup of water and so forth. So that's existing. It's available. It's a little bit more labor intense to make, but it's still, again, a removable appliance.
So what's the next level?
The next level is what we'd like to do, of course, is to provide our patients with a fixed type of restoration, permanent set of teeth that do not come out.
Okay.
These are, again, done on the lower jaw with a minimum of 4 implants. So if you're able to get a removable with a bar, then you're probably a candidate for a fixed permanent set of teeth with dental implants.
Now, the upper denture, though, has, a little bit of suction. So that's pretty good, right?
Of course not, Randy. This is a miserable piece of torture device that you have inside your mouth.
Okay.
This piece of plastic inside your mouth covers the palate, doesn't allow you to taste your food. You can't taste the temperature of the food, and it's unbelievable the number of times that patient comes to me and they talk to me about the temperature of the food and not about the taste of the food. They want to feel the coffee. They want to feel the hot coffee or the tea they're drinking.
Especially tasting wine or things like that.
Exactly.
So the roof of the mouth is
the roof of the mouth has a lot of glands that are helping to help experiencing your food.
So you uncover that.
So we uncover that, exactly. By placing multiple implants in the upper jaw, we're able now to provide them with a fixed set of teeth that is not coming out anymore. The palate is free. The prosthesis is much smaller compared to a conventional denture or what we call an overdenture, which is a snap in and snap out, that does not have all this bulky piece of plastic that covers the lip, covers the tongue, and hoovers the roof of your mouth. So it's a much smoother, more natural life experience that patients get with
And they can eat whatever they want.
And they can eat whatever they want, probably from the day after the surgery.
And most of these people, you said almost everyone is using IV sedation.
Absolutely. So we love to sedate our patients for this procedure. Again, by definition, this is a surgical procedure. We want them to be comfortable. So they come into the office, we sedate them lightly, they don't feel, they don't experience, and they don't remember any of the work, and they wake up with them, after the procedure, and they have, within hours after that, a set of teeth ready to go.